Hello again, week 2 discussion post. My name is Melanie. The scrubs aren't for costume or effect. I really am a medical assistant coming to you live from my office. So, with the added symptoms and lab results, my initial diagnosis have not changed. I'm leaning more towards maybe a diagnosis of hepatitis or autoimmune disorder, possibly lupus, or maybe, a combination of a couple of them. So, from the Epstein article, which my references will be posted below the video, I discovered that high LDH levels come from damaged cells. This could be from heart attack or other cardiovascular disease related issues, but I still tend to lean towards my cardiovascular symptoms as being caused by the unknown disease as opposed to being primary. Sorry, I totally lost my space when I was reading up there. I also learned that alcohol and narcotics could increase levels of LDH into the blood. This information further led to my diagnosis or possible diagnosis of hepatitis C, as long-term use of IV drugs and heavy drinking are common in the social history of patients diagnosed with hepatitis C. Additionally, higher levels of the LDH4 and LDH5 could indicate liver or muscle damage, but further blood work would be needed to sort of figure out exactly which was going on there. So from, subtle hints provided, I also researched, autoimmune disorders. I do think that the symptoms presented could be autoimmune related. Information from Johns Hopkins shows that the symptoms can be fairly generic and mimic almost any other condition a doctor might consider, very much similar to the metabolic syndrome. None of the symptoms are clear and concise. It doesn't just say, oh, well, this is one thing. It could be, multiple things. Lots of different lab tests are going to be needed. I definitely believe this is a chronic condition. None of these symptoms, have just happened. Like, they've been slowly occurring for a while. So I'm definitely leaning more towards, some sort of autoimmune disorder, possibly co-occurring with the metabolic syndrome. I wouldn't rule out diabetes, possibly type 1, as it is autoimmune, and it could be, metabolic syndrome related and stuff. And there we go. There's week 2. Hopefully this works out. Hopefully I answered your questions. Thanks.